Okay. Oh, sorry. Continue. So hi everyone, thank you so much for coming today. My name is Tammy and my co-presenter is Holly, and we're going to be talking about the Jack.org Youth Voice Report and about elevating the youth voice during COVID-19 and beyond. But before we get started, we just wanted to do, there we go, a couple of quick land acknowledgements. So first off, Holly and I are both in Toronto, so we want to acknowledge the land on which we are currently meeting. So for thousands of years, where Holly and I are has been the traditional land of the Huron-Wendat, the Seneca, and most recently the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. And we also know that most of you are probably in Montreal. So we want to acknowledge that McGill University is situated on the traditional territory of the Canadian Kahaka, a place which has long served as a site of meeting and exchange amongst many First Nations, including the Canadian Kahaka of the Haudenosaunee Confederacy, Huron-Wendat, Abenaki, and Anishinabeg. We recognize and respect the Kanien'kehá:ka as the traditional custodians of the lands and waters on which you are all today. And Julia has kindly put in the chat to check out where you are at nativeland.ca. Thank you for that. And one last thing, sorry, I forgot to mention, for anyone that's coming in late, if you could go to pollev.com/TammyR122 for some polls we're going to be doing. I just put that in the chat. Go ahead, Holly.
Great. Yeah. So I'll just introduce myself quickly. I am Holly. I'm the manager of impact and evaluation at Jack.org. So, there's like two parts to my job. So what I do all day long is work with Tammy to evaluate our programs. So try to figure out like what's going well, what can we improve on, what are kind of the youth that we work with saying about the work that we do with them and improvements that we can make, and what is our impact broadly and how can we share that with our stakeholders. So that's kind of the evaluation bucket of my job. The other bucket is the one we're going to be talking about today, which is the kind of youth voice bucket. So Tammy and I work together to put together this youth voice report, and we also do the campus assessment tool project, which you guys actually, some of the folks in the room, I know Julia did a couple of years ago, and so that's sort of another aspect of really just bringing youth voices to bear on decisions affecting their mental health and making sure that the priorities that we're surfacing to decision makers as like Jack.org, the organization, are really grounded in that youth voice. So that's kind of my current job. I've been at Jack.org for the past 4 years, and before my role in evaluation, I actually worked on the fundraising team. So it's been cool to kind of see different aspects of the organization. And before that, I lived in Ottawa, and I went to Carleton. I worked as a political staffer. So that was sort of my previous life to this one. My undergrad is in political science, and I'm actually in the middle of my Master of Public Health right now at U of T. So back to school for me as well. And so it's a good way to be passing the time during the pandemic. So yeah, excited to be here and chat with you all.
Yeah, and so I'm Tammy. I'm the evaluation lead. So Holly mentioned a lot of the work that we do together. The biggest difference, I would guess, not biggest, but for me, I get to play around in the data a lot more, whereas Holly's a bit more big picture. So I get to kind of poke around in spreadsheets and look at a bit more of the nitty gritty, which is something that I really enjoy. I joined Jack.org back in June of 2020. So I actually haven't been to the office. I haven't seen Holly or any of my coworkers in person, which is a wild experience. But I guess that's where we are right now. And before that, I worked as a data analyst at U of T, and before that, I finished my PhD in cognitive psychology. So I'm really into data and research and all that kind of stuff, which is why I love working for Jack.org and working with you guys and all that. And one last thing I wanted to mention is I just want to acknowledge that we are talking about the Youth Voice Report today, but as you may have noticed, we don't really have any youth voices in our presentation. And everything we're discussing today was developed with the help of Sope, who is our youth network representative up in Nunavut. Her contributions were integral to this presentation, but unfortunately for us, she is being busy being a nurse today and is off saving lives, so she was unable to make it. But we wanted to make sure that she still got a shout out anyway because of all the hard work she put into this presentation, despite not being able to be here today. So with that said, let's talk about, oh, sorry, one last thing. Uh, yeah, so go ahead, Holly.
Yeah, no, the agenda, great. So this is just a little preview of what we're going to talk through today, but I'm going to share a little bit about what Jack.org does kind of broadly, just as an intro. Tammy's going to talk through the process of what is the Youth Voice Report, the process of creating it and how we went about that. I'll share a little bit about kind of the key themes that we heard when we talked to young people. And then Tammy's going to share kind of what recommendations do we have that came out of that. And then a bit about next steps for future years and for advocacy from the Youth Voice Report. So just a little intro there. Yeah, and so what do we do all day long at Jack.org? So we are a national charity working with a network of young people across the country to break down barriers to mental health. And we work with young people who are like, we say 15 to 24 roughly, although those aren't like the most firm, but generally like high school and university aged youth. And we do that through 4 different programs, which you'll kind of see here, and I'll talk through each one. So the first one is our Jack Talks program. So in the Jack Talks program, we train young people in mental health literacy and public speaking skills so that they can give, sorry, I don't know if you can see the blanket moving next to me. My cat is pulling some shenanigans at this particular moment, so apologies for that. There's not a ghost in my apartment. Yes, the Jack Talks program. So oh yeah, Herbert, amazing, nice to see you. So as Herbert knows, we train folks like him in mental health literacy and public speaking skills so that they can give presentations to other groups of young people across the country. And so that's really about kind of building a foundation of mental health education and literacy and encouraging help seeking among young people. So the presentation talks through things like how to recognize signs and symptoms of mental health struggle in yourself or in your peers, and then how to respond to that. So how might you engage in a conversation about mental health with a loved one that you thought was struggling, or seek help for yourself or others, what resources are available, that kind of thing. So that's sort of our intro. Then we have our Jack Chapters program, which you guys, I think, still have a chapter here at McGill, but I know Julie has been active in the past. And yeah, okay, great. Yeah, and so Jack Chapters are similar to the one at McGill, youth-led groups that are working on identifying barriers to mental health in their communities and breaking those down through initiatives throughout the year. So Jack.org provides a bit of support and resourcing for that. And initiatives look super different depending on the communities that they're in. So if you're in a community like McGill, for example, is kind of, you know, those mental health conversations, a credit to the folks in the room, are happening fairly openly a lot of the time. And so in the past, you know, we've worked with the students here to advocate for specific like policy changes or service changes and that kind of thing. So that's sort of like further kind of, I guess, advanced along the spectrum, whereas you might have other communities where they're just starting out having the mental health conversation. So we've had like high school students organize like a parent student night to talk about mental health because they're like, oh, the students are really talking about it a lot, but our parents don't seem as like aware of the kind of struggles that we're having. And so opening up that community conversation is an example of like the different types of initiatives that we could do. And then we have the Jack Summits program. So folks in our network in the Talks and Chapters program and more broadly come together to deepen those advocacy skills. And also surface, we'll talk a little bit about, but it's not just sort of absorbing a bunch of presentations, but it's really like youth coming together and identifying the priorities that they're seeing, whether it's in their regions or nationwide, so that they can communicate that to decision makers. And then we have our Be There program. So Be There really informs the Jack Talks program quite a bit, but it's our digital resource. You can go to bethere.org, and it walks folks through like a really simple framework for how to have a conversation with a loved one you think might be struggling with their mental health. So just some like basic principles for that. And then we've got like, we filmed videos with folks. So you know, it's like a young person who needed support and their friend who supported them, and they kind of talk through like, oh, it worked really well when you said or did this kind of thing, and not so well when you did this. And so it's an opportunity to kind of see like, okay, how might I have this conversation if I'm uncertain about it? How might I like troubleshoot issues that I run into? That's kind of a quick overview of our 4 main programs. And then these all ladder up into these bigger goals, right? Which is increase youth capacity for mental health leadership and advocacy, and connecting a national network so that young people can reduce barriers to help seeking, and increase mental health knowledge, improve attitudes, and increase youth access to mental health. Yes, who's in the room? So we'd love if folks could just like pop in super quickly with your name and like either the program you're from, if you're a student, or your organization, and if you're all in Montreal, or where are you, just to get a sense of who is in the room, if you don't mind taking a second to do that. Don't be
Everyone,
shy.
a couple more seconds. I understand
Yeah,
it's probably been a bit of a long day for you guys. I know
that's
that
true.
you guys have been doing this conference for a few days, so all good if you're not feeling up to it.
Yeah, that's fine. Yeah, feel free to hop in at any point. And also just like if you, oh, hey, Sarah. Oh, Masters of Divinity. Super cool. Thanks for joining us today. And feel free to pop in through the chat if you have any like questions or comments along the way. At jack.org, we're sort of big fans in our staff meetings of just like commenting on things that people say and like right in the middle of things. So please don't hesitate to jump in. Hey, Julia. Hey, Herbert. Oh, music program. Very cool.
Congratulations.
Amazing.
I know it's been a couple years, but still congratulations. But is always a thing to celebrate.
Yeah.
All right, so moving on. We're here to talk about the Youth Voice Report today. And so some of you might be wondering, what is the Youth Voice Report? And so this is an annual report that's put out by jack.org, I think for the past 3 years now. And it's a report that addresses the biggest concerns around mental health from youth in our network. This is, based off of surveys and feedback we get throughout the year, and sort of gauging what are the biggest concerns that youth in our network are bringing forward, and what are their proposed solutions to those concerns. The youth in our network are people who are really tuned into the mental health conversation in Canada and have a better sense of the kinds of barriers that their peers are facing when it comes to mental wellness and getting help for their mental health concerns. And so this report really tries to plug into those concerns that that the youth advocates in our network are both experiencing as well as seeing within their communities. And the idea is to put forth recommendations for decision makers, such as government officials or educators, based off of both youth insight as well as research and best practices. At least that's been the case in the past. We might be shifting our focus to be more toward the youth voice in the future. But at least for this report that we're going to be talking about today, that was the focus that we had. And most importantly, the Youth Voice Report across all years has elevated the youth voice so that it's heard loud and clear across Canada. And so given that this report is focused on the voices of youth and that you're all here because you're interested in mental health, we want to know how many of you have advocated for mental health in your institution. So this is where that Poll Everywhere link comes in. Let me just double check that the activity is working. Beautiful. And so what we want to know is, have you previously advocated for the youth for student mental health in your own institutions? For anyone that may have popped in late, I'll drop the link to the Poll Everywhere one last time. So far we're just getting, we have a lot of youth advocates in the audience. It makes sense given the content of this presentation, but that's really great to see. And some people who might be a bit new to advocacy, and that's totally fine too. It's a process and everyone starts somewhere. I'll give that a couple more seconds. And I wonder if I can see how many people have responded. Unfortunately, I can't, but that's okay. All right, so that's really great to see that we have people who have done this before and people who might be little bit new. Hopefully we can share with you some of the insights that we got from youth in our network and give you some ideas of how to do that if you're interested. It's definitely a daunting thing, and so it's understandable if it's still something you're not quite ready to do. But hopefully, this gets you thinking as to different strategies to advocate for student mental health in your own institution. Um, okay, sorry, I'm working with two different screens right now, and it's okay, there we go. So the first thing we want to talk about is how we created the YVR. And so the way that we did that was primarily through surveys, and we did that by surveying youth in the network who went through various different programs of ours in the last years. That would have been the 2019-2020 school year. And we compiled responses from just over 1,000 people. And this is the makeup of our respondent pool. So majority of them were women, some men, and a few non-binary people. 22% identified as being part of the LGBTQ2S+ community, 29% as a visible minority, 6% as Indigenous, and 55% identified as someone with lived experience with mental health illness. And of course, this breakdown is not at all representative of all youth in Canada. It is representative of the youth who are highly engaged in the mental health conversation, at least through jack.org, and have unique insights into youth mental health in Canada. And so we used a few different data sources to pull together the different themes of the YVR. First of all, surveys, which I've talked about already, as well as collaboration sessions, which Holly will discuss in a bit more detail later. We also did some individual interviews with network members and a literature review to see what researchers and what best practices there were out there and how that may or may not align with youth voice and youth suggestions. And so in terms of the surveys, we have a few surveys that we pulled from. So there are the Jack Talks. So Holly spoke about these programs before. So for Jack Talks, we have speaker registration and year-end surveys. For Jack Chapters, again, we have registration and year-end surveys. And for summits, summit delegates fill out applications. And in all of these surveys, last year, we included what we called our youth voice questions. And so these are questions that are on a variety of different themes around mental health, such as mental health and academics or relationships, access to services, finances, social media, to get a sense of what youth feel contribute to mental health struggles, where they're seeing barriers to accessing mental health care, and where they're seeing mental health stigma still be prevalent, if at all. And the goal of these questions are just to get a better sense of how you feel about the landscape of mental health in Canada and where they're seeing maybe the biggest challenges are, so that we can really point to those challenges and point to possible solutions within the Youth Voice Report. And so some questions that someone might have seen in one of these surveys are things like, I face constant academic pressure and this negatively affects my mental health, and then rating that statement on a 1 to 5 scale from strongly disagree to strongly agree. And then again, we also pull from collaboration sessions, which Holly can speak to a bit more than I can. So go ahead, Holly.
Yeah, so this is like the youth voice part, or there's a lot of summits that's youth voice related, but this is kind of the big one for us. It's like a really major centerpiece of the programming. So this is where we sort of bring youth advocates together and kind of folks are like, okay, I'm going to think about gaps and barriers that I'm seeing in my community, and then we're going to talk about what goals might we set to address these problems, and what are some recommendations we might give to decision makers to improve the mental health system. So it's really about surfacing those priorities to decision makers. So Tammy will talk a bit more, but the sort of the findings or the priorities that youth surface through these sessions were a really big piece of what informed the Youth Voice Report. And it's worth noting that there's like challenges with this too. So we talked a bit about Sope, who's been really involved in the creation of this report and presenting it. And we had to transition our national summit, which is usually held in Toronto, to virtual back in May when we were doing this. And it posed a lot of barriers for folks in the North who didn't have reliable internet access. So all that to say that some of the challenges we're going to discuss in this report are challenges that Jack.org also faces in our work trying to engage diverse youth perspectives around mental health from different regions of the country. And so SOPE has been great at helping us to kind of get a tighter lens on some of those concerns from the North especially, but it's something we continue to work on as well. So.
Absolutely. And speaking of COVID-19 and different challenges, one of the things that we did do is adjust some of our data collection, not methods, but questions to respond to COVID-19. Because of course, back in September of 2019, when these surveys were first developed, nobody really knew what was coming. So there were no questions around physical distancing and how a pandemic affects mental health, which I think we're all still figuring out as we go. But back in March, when shutdowns occurred across Canada, we made sure to add in questions around mental health in the pandemic. So these were added again within the youth voice questions of surveys for those year-end surveys, as well as the virtual summit experience surveys, in order to just get a sense of, how people were feeling with physical distancing, how people's access to mental health services has or has not changed, how academics have changed with the advent of the pandemic, and just get a better sense of how this very very unique situation has been impacting the mental health of youth within our network. And we also focused our national summit on COVID mental health needs, and as Holly has kind of alluded to, including how the collab sessions were structured. And so given that our biggest data source for the YVR was a mix of surveys and collab sessions, but we also know that there are so many other ways to get feedback from youth. So this leads me to our next poll everywhere question, which is, how would you prefer to provide your own feedback to decision makers and to people who are making these decisions that end up affecting your mental health? So if you want to just type in like a 1 or 2 word response, it could be something like, maybe you do love surveys, or maybe it's focus groups, maybe it's interviews, maybe it's something a bit more creative. Feel free to type those in. I'll give everyone a few minutes for that as well. And if for whatever reason the poll everywhere isn't working, it should be, just like pop that in the chat so that I know that you're not seeing this question on your screen. Bidirectional, oh, I like that a lot. So also getting feedback from them. Working groups, yeah, poll everywhere is weird. If you put 2 words in, it still separates them out, but I assume that was probably working groups. I'll give everyone a couple more seconds. But those are really great points, and is definitely something that we're trying to get a bit better at on the eval team, which we can speak about a bit later in the presentation. Okay. Oh, share experiences, discussions. This is all really great. So it seems like, at least within this group, it's a lot more about a conversation rather than just a one-way feedback channel, which makes a lot of sense. So again, we're working on that. And if you have any recommendations on how we could be doing that better, or how you would want that to be done, please come to us. Because again, we're trying to get better as we go. And Herbert's saying I meant discussion groups to share experiences. Yeah, poll everywhere doesn't like sentences, but thank you for clarifying that, Herbert. Okay, so once we had all the data from the surveys and the collab sessions, what we did to start pulling out themes, because we ask about a lot of different aspects of mental health, and we don't want the report to be 100 pages long, so we have to just focus it on a few, is we pulled out themes based off of percent agree and strongly agree survey responses, with the idea being that we want to look at where there was high agreement or high disagreement among all the youth in our network, and if there were interesting patterns between questions of similar themes. And so this is just a screenshot from one of those spreadsheets we were working with. And so we can see that the different statements that people rated are grouped by theme. And up at the top here, you'll probably notice that for the academic questions, across the board, there was pretty high agreement. So we're seeing that consistently, the youth in our network are pointing to academic pressure, academic stress being a big, having a big impact on their mental health. And so that's how we started to pull out some key themes we wanted to focus on. We also did some rough coding of qualitative responses to help supplement those themes a bit and get a bit more nuanced data and nuanced information from the youth in our network. And so we did, like I said, some very rough coding. This was not at all a formal process, just one person kind of going through responses to different qualitative questions and coming up with new categories as needed. And then also highlighting some quotes that really seem to emphasize things that are coming up over and over again, to help demonstrate the youth voice more strongly. And so some of these questions were things like, what has made you feel unsupported or supported by your school during the COVID-19 pandemic? And if you could pass on tips and tricks to educators about how to make the classroom or lecture hall a more mentally healthy environment, what would they be? To really get a sense of what youth in our network want to see done differently, and what's working and what's not. And then we also went through the collab session themes. So again, looking at what topics are coming up across different collab sessions, what similarities are there across the country? So we have summits, we have our national summit, but we also have summits in Atlantic Canada, in Northern Canada, in BC, in Quebec. And so, these are all very different contexts when it comes to youth experience as well as mental health. And so seeing where there are these similarities and where are there differences, where are we seeing some more region specific issues that might apply to one area of Canada and not so much another. And then once we had our key themes, we did a bit more of an in-depth literature review, again, to see what researchers are saying about the issues that we wanted to identify, as well as what best practices exist out there already that we could put forth if they are aligning with youth voice, and highlight if they're not. And we also did some interviews with individual network members in order to get a more nuanced sense of people's insights and opinions, specifically to get testimonials, not just on their advocacy work, but also their own personal experience and perspective. So kind of getting a sense of both, what is it like being a young person in Canada and experiencing barriers to mental health, and also what is it like being a young advocate for mental health in Canada. And so with all that said, we came up with a few themes, which we're going to talk about now.
Yeah. So yeah, as Tammy alluded to, academic stress is one of the big ones. So I'll talk first about that one. Then the kind of two other ones that we saw that came up that were quite interesting were sort of this like hope and hesitancy around digital services for youth. So I'll talk a bit more about that. And then we'll talk about the need for culturally appropriate services as our third theme. So academic stress, yeah, as that spreadsheet showed, it's like the biggest theme across whenever we ask our network. It's the one that comes up time and again as being really like heavily endorsed. So in this most recent survey, 94% of our network said that it was a factor. And so that really cuts across both post-secondary students, but also high school students, which I thought I would have expected more of a weighting towards post-secondary, but we're kind of seeing it across the board when you're getting to numbers that are that high. And kind of 70% also agree with the statement that's a little bit more intense, which is that like academic pressure negatively affects my mental health. The nuances of this are pretty interesting. So when we review sort of qualitative comments, a lot of what we see is a lot of concern for the future. Like, I think I still technically fall into the millennial bucket, and that this sort of fear of the future or uncertainty about the future rather, and economic uncertainty, and sort of how do I secure a good job after school? Like, these are all really big questions that are influenced by our broader social context. And as if you're like going through your degree, the thing that you have control over in all those questions is some degree of control over is your academic success. And so you can see how that would generate a lot of pressure for young people. When you sort of dive into like specific practices, we hear a little bit about like the classroom not always feeling like a super open space to have a mental health conversation, or not always being able to talk to your prof about having mental health needs in the classroom. And also lots of discussion about different tight deadlines, assessment practices, and that kind of thing. And so I won't sort of steal Tammy's thunder when she talks about recommendations, but there's a lot around like professors modeling discussions and kind of opening that door for students and considering that in the way that they set up their classes. And I think actually two stories kind of that are highlighted in the YVR really illuminate this. Like we heard from from Jay, who's a student in BC, where he had an experience where he was having a mental health struggle and he had to drop a class. And he sort of had the professor like check in with him a little bit, but he kind of wished that he could have had more support so that he maybe would have been able to complete the class instead of having to drop out. And on the flip side, we heard from Ezekiel, who's a student in Ottawa, who said that actually he studies international development, and in his department, the professors and the deans have made like super clear that mental and emotional health and well-being of their students is the top priority in their academic department. And so he really got the sense that like, okay, they're setting this like standard of support, and I know that I don't have to, like, I can discuss this with my professors, and I know that they value my mental health, so I feel better about like contributing to decisions that are happening in my like department as part of like the students group providing input, and also like more positive, like more able to engage in the learning that's happening in the classroom because he knows that he has like the support system behind him. So those are two kind of really interesting illustrations, I think, of what we're talking about there. Yeah, great. Thanks, Tammy. Moving on to digital services. So this one's super interesting. It was like very much, I think, a feature of the time that we were asking these questions, which was like in May, in the middle of the pandemic. As we were saying, there was a lot of optimism expressed in the collaboration sessions around like, oh, maybe digital services will be able to serve these like remote and underserved communities in ways that like they haven't been able to access support before. What's interesting is that when you ask the Northern Summit delegates, they actually have a different perspective, which is we sort of alluded to, but like, oh, internet access isn't super reliable. And actually, maybe digital services wouldn't be super culturally appropriate for our communities. And as I mentioned, they like had trouble even joining the virtual summit because it was virtual. And so there are like some pretty big accessibility concerns. And, you know, there's reason for hope, and there's also reason for to sort of not treat digital services as though they're the silver bullet, according to the young people in those communities. I just have a quote from Sope here, which is, digital services are one of the biggest things that we struggle with in Nunavut, and it affects the way that we receive mental health services here since the internet is very unreliable. It becomes something that's exclusive and we can't be a part of. So that quote really stands out to me because it's like, oh, this thing that we want to solve this problem and to increase access can actually contribute to further marginalization if we're not careful about the way that it's implemented and embedded in the community. So I thought that perspective was super interesting. And moving sort of beyond the sort of regional aspects of that discussion, we actually heard a lot, even from like, you know, it's like the people in this room, right? Like the Jack.org network is like super informed about mental health, and they're super open to having conversations about it. So that's the bucket that they're in. And we saw that, you know, like 57% of our network were accessing in-person services before COVID hit. And at that point in May, so that, I mean, had been like 3 months into the pandemic, only 37% had accessed online services. And when we asked sort of general questions that were like, do you think digital services would meet your needs? And do you think they would meet your needs as well as in-person services? When we asked, well, we sort of asked things on a 5-point Likert scale. So 1 is like, no, not at all. 5 is like, yeah, totally. And 3 is somewhere in the middle, or like neither agree or disagree, as Tammy is always telling me. And what we saw was like most respondents were hanging out on that 3 marker, which says to me like, there's a lot of questions still to answer. We don't totally know what the nuances of those questions are, but we can guess about sort of, you know, is the way that these services are delivered and accessed super transparent to young people? Do they have sort of information about their efficacy and that kind of thing? So these just raise, I think, some really big and interesting questions. And I think the headline here is that we just need a lot more information on this stuff to figure out sort of where the barriers are, and if this gap has sort of closed over time. So I think I expect this to be one of those themes that is going to continue, you know, in the mental health space broadly well beyond the pandemic. So it'll be interesting to see how that progresses. And then moving on to the third theme, culturally appropriate services. So 76% of our network agreed that a lack of culturally appropriate services was a barrier to help seeking. It also came up in a couple of the collaboration sessions, particularly in the North. so this quote from one of the Northern Summit delegates is really illuminating in my opinion. So language around mental health is created by Western mental health professionals and feels as if it's been dropped into Northern contexts. So that, really speaks to me in clear language, and is like, okay, like it's more than just, it's like the word language is used, but it's more than just like, oh, they're speaking in my language, which Western organizations aren't if you're speaking a native language in the North. But it's also about like, okay, what are the sort of the nuances in the way that mental health is framed? Is it sort of framed in an individualistic like Western way, or is it meeting the needs of potentially a more holistic view of mental health, or what have you? And so that was flagged at the Northern Summit, and also our Breaking Barriers Summit in the Prairies. There were quite a number of comments that focused around the different access that international students have to mental health services. And so one of these comments is citizenship status is a barrier to many international students and prevents them from accessing services, not to mention sort of the linguistic difficulties that likely result for a lot of students. So we do see this coming up a lot. I'm just gonna say a thing that Sope said, because she's so smart, and we could have printed her entire interview for this section. I think we could have, because she's has so much to say on this subject. But speaking about her sort of experience and her community in Nunavut, the need for culturally competent counselors is super high because of the severe trauma that the Inuit have faced over different generations. And so counselors need a strong understanding of that history and social context to be able to treat people effectively. And so Sope is advocating for an addictions and trauma center in Nunavut that's Inuit specific and Nunavut specific in order to break down those barriers. But it's a challenge, and it takes time, and it's sort of, she's really in it for the long haul, because it's like a promise that the government made when they were sort of being elected, and now waiting to see that promise realized is not as smooth as we would hope. And so that's sort of another example of that need. There were a couple other stories too in the Youth Voice report that you'll find that stood out, especially around like different family and cultural contexts for some of our youth. So we heard a couple stories about like, how do you navigate this mental health challenge with family? And especially, like, it's interesting, especially both of the folks we spoke to were like living at home. And I'm not sure if that was like, to me, that's also like part of the pandemic experience, right? Where everyone's at home all the time, and you're not sort of out of the home very often. But they shared experiences where they were like, one of these folks was like coming out, and this counselor was like, come out to your parents, and the person was like, that's not going to work for me, like that's not going to work for my family, so I need to figure out another way. And sort of another person who was like, the counselor was like advocating for setting strong barriers with their family around these like mental health things, and and that's like, maybe fine advice, and also like maybe didn't, at least in this case, didn't fit with this person's understanding. She's like, I want to heal with my family. Like I'm coming from this culture that like we look at things holistically, and like it's like a collective thing and a strong social support network, and sort of these more individualistic sort of perspectives weren't necessarily meeting those needs. And another thing that youth flagged was like, cultural competency doesn't necessarily mean that someone looks like you or comes from the same background that you have. We did hear a couple stories about like, oh, this person was from the same place that my family's from, so we just like had a rapport and a shorthand right away, and I didn't have to explain myself. But then there were other people that said that part doesn't matter so much to me. It's like, if you're trained in relating to me, even though we don't have the same background, like I'm good, and that's enough for me. So I think there's a lot more exploration that needs to happen around this theme from the perspective of our youth, to kind of parse out like, okay, what are the specific practices and tools that we're talking about when we talk about these culturally appropriate services. So now that we've gone through the main themes, we've got some poll questions, but I think what I'll do is actually just suggest that like, feel free to type sort of any reactions that you have to these questions in the chat, and we can kind of go through them at the Q&A if there's anything that comes up. So Tammy, do you mind like cycling through the slides for a second, just so we can see like what the questions are? Great. So what theme resonated with you the most? I think the next one is, right, which one are you most interested in learning more about? And then, oh, or you can also respond to the poll. That's totally fine. And then which theme are you most surprised by? So feel free to jump in on those polls if you want to. We'll wait a couple seconds, and you can also pop in any thoughts. So what surprised you, what resonated, and what do you want to learn more about?
I could probably guess which one resonated given the audience, but I don't want to speak for you guys. So yeah, feel free to type stuff in the chat. Seems like the most surprising so far was the culturally appropriate services piece. I'm going to go on to the next one. If it'll let me. Oh boy, technology, am I right?
Oh, I'm just seeing Herbert's comment in the chat. Very interesting that some of that resonated. That's really cool. Thanks for sharing.
And then which theme are you most interested in learning more about for your own advocacy work? I think this one's also interesting.
Cool.
Yeah. Cool. All right. So in terms of, okay, so we have these themes, and Holly's kind of talked a little bit about the recommendations, or at least hinted at them already, but just to go over them in a bit more detail, we identified these concerns that youth in our network were having, and for most of them, youth in our network also had suggestions for solutions or things that they would want to see done differently. And what was interesting was, for the most part, we saw that this really aligned with best practices. So like things that, experts in teaching and learning centers, especially for the academic stuff, were already suggesting. And so it was really easy to kind of say like, hey, people suggest this, and also youth are saying that this would be helpful. So let's do this. Like, here's a recommendation. Here are things that can be implemented. And so our overall sort of overarching theme to address academic stress was to encourage the use of teaching practices that support student well-being. So these are things like providing mental health breaks in class, sharing mental health resources with students, especially in moments of stress or transition, facilitating a dialogue around mental health and kind of normalizing that mental health conversation with professors and educators, and making the classroom a space where you could feel comfortable to go to your prof and say, hey, I'm having a really tough time right now, and kind of open up that conversation to be just beyond learning and academics and grades. And then finally, considering more flexible grading and assessment policies. And the interesting thing I want to point out about that last point was that and again, like, I want to emphasize that this might be due to when the data were collected. So this was based off of feedback we got from youth in the network back in like March, April, May, right at the beginning of the pandemic, when everything was even more uncertain than it is now, and everything felt very sudden and new. And so, in the past, youth and students have said, please be more flexible with grading and assessment policies. Like, if I need an extra couple of days, I shouldn't be penalized just because I'm handing in a paper a couple days late because I was struggling with my mental health and all that kind of stuff. And then when in-person classes stopped, a lot of students were getting that flexibility now. And then we were hearing from students in the network that they appreciated this. So, this thing that we asked for, yeah, no, it's actually really helpful, and we really do appreciate it. And one thing that I guess I would be interested to hear from you guys is, if you experience that flexibility back at the end of last academic year, how's that kind of stuck now that we're this far in the pandemic, and or is it kind of a bit more back to business as usual, and that flexibility has now been revoked? And I'm a little curious to hear how that may or may not have been consistent throughout distance learning, variable depending on prof. Yeah, that makes a lot of sense. And then for the next theme of digital services, our overarching recommendation was to help young people access and navigate online mental health services. And so this kind of came from the sense that we got that there was a lot of uncertainty and hesitancy, that there was a lot of hope for what expanding online services might mean for youth mental health, but a lot of uncertainty as to how to even access those services or what those services would look like. And we found that although digital and online mental services research shows that they are effective and well received by those who actually access them, that many youth aren't. So if they aren't accessing them in the first place, then they're not that useful. And so we highlighted a few things. So one was, prioritizing clear communication with youth about available services, making sure that young people know what is even available online and where to go and how to get there. Um, a big one was to consider and address inequities in internet access, as Holly highlighted, especially in remote communities and in northern communities, internet access isn't very reliable. And so if we're going to emphasize the use of these online services, we need to make sure that they are um, able to be accessed by all youth in Canada, no matter where they are living. And that is currently definitely a big problem and something that we don't have in this country. Another thing that we highlighted was to look to digital services as a key complement in a suite of care options. So right now, for many people, online services are kind of the only safe option, but once the pandemic is over, hopefully, we want to make sure that, as Holly said, that we're not looking to digital services as a silver bullet to mental health, and instead using it in tandem with in-person services. So some people who prefer these online services can still access them, but for people who don't, or don't have reliable access to them, they can still get the mental health help that they need. And then another thing was just, we need to collect more data on youth perception and use and barriers and outcomes for these digital services, because a lot really isn't known in this space. And that's partly because up until recently, we didn't really need to know as much about it. And so let's learn more. Let's see what's actually working and what's actually being done. And then involving youth voices in the design and development of services to make sure that as they grow and expand, that they are continuing or even starting to meet the needs of young people in Canada, rather than kind of going in a direction that isn't even helpful at all. And then the final set of recommendations was around increasing the availability of culturally appropriate mental health services. And again, this was based on a mix of youth suggestions, what is suggested in the literature, and where the two intersect. And so similar to the last set of recommendations, we want to emphasize the importance of establishing clear referral pathways and providing a wider scope of services for youth, with the idea being that, we're not saying that mental health professionals should have cultural competency in every single possible area, because it's not possible for one person to be able to address all cultures, all backgrounds, all everything, but rather being able to say, hey, I'm not really versed in LGBTQ needs, but here's a bunch of resources for you. I can refer you to someone if that would be helpful for you if I'm not meeting your needs in that way. So even if an individual is culturally competent in a certain area, being able to have a sense of, oh, here's where I can send this person so that they get the help that they need. And then again, we suggested bringing a wider range of voices to the table when developing and making decisions about resources. So again, bringing youth into those conversations, but youth from different backgrounds as well, because of course, if we're going to expand the cultural appropriateness of services, we need to make sure we're listening to different backgrounds and different cultures, and not excluding certain voices from the conversation. And then finally, something that we highlighted was the importance of investing in community-based emergency response teams to replace police as first responders to mental health crises, and highlighting the fact that police aren't trained in mental health, and mental health emergencies are emergencies, and there should be better options for people to access an emergency service that is specifically for a mental health crisis. And so I think I'll skip our last poll everywhere question as well. And again, feel free to drop that in chat or for the question period if you want to share anything. Our last question was just what solutions are you excited to put forward on your campus? Mentioned here, or if you think we missed something, feel free to drop that in the chat as well. But I want to quickly just go over some next steps for our next Youth Voice Report, which we are already starting to think about. And so one thing that we've talked about is we wanted to increase youth engagement in the process. And so in the past, we've included youth voices within surveys and interviews and collab sessions, but bringing youth voices in earlier on, so helping with question creation and figuring out what kind of things should we even be asking about? Because there could be areas that we're missing entirely, and we're not even asking about because we don't know to. We're also starting to increase the variety of our data collection. So using focus groups to get some more nuanced data from youth, and get a bit more insight into youth experience from different people beyond just interviews. And also thinking about the themes for next year's YVR. There are some things that we haven't really thought about before. And so again, by including youth in the conversation, hopefully we can address some new themes that maybe haven't been on our radar before. And we, it's funny, when we first were talking about this, it was a few months ago, and already we're not sure how relevant this might be, but focusing a bit more purposefully on the impact of COVID-19 and mental health. And so by the time we're collecting data, it might be, again, fingers crossed that things are a bit more in the past, but still kind of seeing, what are the long-term effects of COVID-19 on mental health? How have these stressors changed? Again, I know that things have probably changed a lot since almost a year ago when all this started, and how has the impact of COVID-19 on mental health differed from the beginning versus where we are right now? And so those are kind of the big next steps we have, but I think for now, that's enough talking from us. So if you guys have any questions, feel free, again, drop them in chat or turn on your mic. But thank you so much for coming on a Sunday evening to listen to us. And one thing I just realized, I would be a terrible influencer. If you want to check out the Youth Voice Report, go to jack.org/YVR. That's where you can find it. I just realized we never actually said where you can find this report, but that's where it is. And also, I just noticed that Herbert said from the poll, discussion groups between students and educators on mental health. That's awesome. Thank you, Herbert. So yeah, any questions? Thanks, Maya. Even if you don't have questions, even like feedback, like, hey, this didn't really resonate, or I think that this is something you should focus on next year. Like, if you have feedback for us, that's also great too.
I was just going to say to you, if I don't know if folks are a little bit sleepy at this late stage, but you can always shoot us an email too. We're at holly@jack.org and tammy@jack.org. So if you read through the report and anything comes up or you want to provide feedback, you can always shoot us a note too. So, and yeah, thanks everyone for coming and for listening to us go on, and give us a shout anytime. We're always happy to chat.
Thanks, Tally. And thank you for inviting us. Like, it's so exciting to be part of this conference, and I don't know, I'm honored to have been thought of for this opportunity.
I just want to thank you guys. It was a great presentation, and we will be releasing any questions. We'll be giving them your contact information if they have any further questions.
Absolutely.
Awesome. Great.
Thank you so much.
Thanks so much, Elena. Thanks, everyone.
Thanks, everyone. Have a good rest of your weekend.